Oh, I don't know, maybe I was 4 years old, but as soon as I knew what an animal doctor was, I wanted to be a veterinarian. In fact, my mom tells me that at the age of 3, I used to put Band-Aids and bandages all over my stuffed animals. At the age of 10, I started volunteering at a veterinary hospital cleaning cages. During my high school years, I worked part-time at a veterinary clinic as a technician. I graduated Tuskegee Institute School of Veterinary Medicine in 1978. I did my internship at Angel Memorial Animal Hospital in Boston and joined the faculty at Tufts University Veterinary School. I opened my own practice in 1983, and in 1993, I changed my practice and became an integrative alternative practitioner. Integrative practitioners look at the whole picture, the patient's whole being and environment, by using different modalities and treatments to stimulate the body's ability to correct its deficiencies, strengthen the immune system, bringing the body into balance in the least invasive way possible. To practice healing with this intention, an integration of the mind, body, spirit is achieved.
So basically, I ended up being very proud about being a veterinarian. I thought I had worked so hard to become a veterinarian, to save lives, to help animals, to cure illness, and to increase the quality of life.
Because you go into veterinary school and you think, oh, I'm going to be a doctor, I'm going to heal, you know, I'm going to help these animals regain their health, and you want to see that.
And I was floored at the beginning of my career by how many cases we couldn't help. And I was finding more and more that I was being taught by veterinarians there at this practice, which was a very well-known, very good practice in the allopathic sense, that basically antibiotics and steroids was all you could do. If that didn't work, try a surgery. If not, euthanasia was your option. And I couldn't believe it.
So here I go through veterinary school and I'm a veterinarian. All I saw was suffering, and I couldn't relieve it. Not really.
I wasn't getting cures, I wasn't getting healings. You may change the face of the disease, but you weren't changing, you weren't making the animal healthy. And it was dead end after dead end after dead end.
One that sticks in my head was like a cat that had arrested, and I worked really hard and brought it back and got a heartbeat again. And I go to the specialist, now what do I do? He's like, it's a gomer. Like it's useless, don't try anymore. And these were the best of the best people teaching me, and they were just like, give up. And this is somebody's loved pet that, if they only knew.
It's not easy to say there's nothing can be done. We'll have to put the dog to sleep. And looked into the eyes of that child. I said, hey, just because I was ignorant of a solution didn't mean that I shouldn't seek one. No, my God, I didn't discard veterinary medicine. And I thought, there's got to be another way. Maybe not a better way, but at least another way. I mean, God knows there's a lot of roads come to Boston. Huh? Why should I say, you've got to come on Route 90?
I think there's a place for all forms of veterinary care in our animals' lives, but I do think there's a lot being done in the name of animal care that I, as a veterinarian, actually find a bit embarrassing.
It's extremely hard to find a cat healthy at 6 years of age. For me to find a 6-year-old cat healthy, that's a treat of the day. They all start having the chronic problems with the teeth and the urinary problems, ear problems, skin problems, tons of problems.
I've seen a huge increase in the number of cancer cases I see, and the age of onset just seems to keep getting younger and younger.
Besides that, I'm seeing animals getting sicker and sicker, much younger. Something that I'm really concerned is about that the human beings are getting sicker and sicker themselves, and I think that reflects on their animals.
I've been in practice, allopathic practice, for 38 years, and I realized that something was wrong. The animals weren't getting better. We were suppressing them. They would get better, they'd come back, and they get better, and they come back. Why is it that everybody keeps coming back?
What would be done would be using antibiotics, steroids, many kinds of them, antihistamines, maybe desensitizations, things like that. But they have to be done all the time. The problem returns and it's never cured, and the animal just gets, the disease is driven deeper, the problems are driven deeper into the body. So it's never a cure, it's just managed, and not very well usually.
Every time the body had some kind of a possibility of an infection, there was an antibiotic. The fact that the body had all kinds of white blood cells and antibodies floating around, it didn't mean anything to anybody. They just suppressed that. Symptoms of the language of disease, not the disease. So everybody was giving him antibiotics and shooting the messenger. The body's saying, help me. And what is it getting? It's getting drugs. So that the natural ability of the body to heal is very much compromised. Very many of the diseases we were seeing, they were related to the immune system. Well, what were we doing about that? We were destroying the immune systems of the animals with over-vaccination.
There's more and more research that shows that we do not need to vaccinate as often, that we have better and better vaccines that provide lifetime immunity. And just as with everything we put in our bodies, there are benefits to vaccination, but there are also risks, whether it's immune-mediated disease, where the body starts destroying different parts of itself, whether it is cancer. We now know that injection site sarcomas occur in cats and dogs and people and horses, and we know this is a real issue, and we need to minimize vaccinations whenever possible, because while they have beneficial effects, they also have detrimental effects.
The rabies vaccine is full of antigenic protein. It has adjuvants. It causes all kinds of neurological, both central and peripheral problems. It can cause dementias. It can cause degenerative myelopathies. It can cause a variety of other immune-mediated destructions of the body, the liver, the joints, the blood, the GI tract. It's capable of producing serious reactions. The stupidity of the whole vaccination issue is that we've been vaccinating animals with combo wombos for years.
Nobody really looked at the big picture of what was going to happen to any individual, human, animal, or otherwise, that was vaccinated too often.
We don't have to do it every year, which there was never any scientific proof at all. Everyone since 1978 has known that in the profession. And then when you get your practice built around the economics of it, then it becomes not only a judgment call as a scientist and as a doctor, but also as a business person.
And it's amazing to me still that all these clients that come to me that are open for all the alternative ideas haven't even heard that over-vaccination is an issue, and can't even believe that there's an option not to have vaccines every year.
We have, at our veterinary medical teaching hospital, been on a not more often than every 3-year vaccination program, and we have not had a single animal out of all those animals that are vaccinated at our hospital ever develop a vaccine-preventable disease like parvo, distemper, or adeno. And believe me, we would know about it, especially since many of the veterinarians in our area do not agree with that program. And if they ever saw one that came from the veterinary medical teaching hospital, it would be on the front page of the local newspaper. So we feel very comfortable with our guidelines and the protection afforded by these vaccines. Giving them every 3 years gives you just as much immunity as giving them yearly.
Over time, the most loyal clients who were vaccinated every year had the most unhealthy animals. Two biggest contributors to ill health in companion animals today was the overuse of vaccinations and the feeding of commercial pet foods.
And the preservatives alter the genetic code so that it affects the gene pool. You have a puppy born, a year later she's been in heat once, she gets bred, she has puppies, her litter, a year later, puppies. In 10 years with puppies, you have 10 generations in 10 years. 10 generations of human beings takes 300 years. And all of the genetic stuff that's out there, that's created by over-vaccination, by lousy food, by drugs, all of those things that are affected by that, you have it condensed, you have it concentrated, and now most dogs that you see come into the animal hospitals, they're genetically compromised.
I had the opportunity to discuss with these breeders breeds that had been living into their late teens, early 20s, were now dying at 10, 11, 12 years of age. And the breeders then began to, you know, ask themselves why this was happening. And eventually many of them looked at what were the changes that had occurred during the time that they had been breeding their dogs. And one of the biggest things was going from sharing food from the table or the farm, whole foods, to the shift to feeding only kibble dog foods.
I used the analogy. I said, okay, does anyone ever watch National Geographic and you watch the wild animals? So do you see the lion go for the pounce and the prey and they catch him? So now, why do they delete out the part about them taking it over to the barbecue pit? Have you ever figured that out? And then they'll laugh, exactly. And they'll say, see, there is no barbecue pit. I said, they get it raw. And I said, in fact, they get it in the best form of raw.
You know, they lived millions of years on that kind of food, and why would it be now different? We didn't invent the wheel and how to feed the animals just overnight. This commercial food markets, it's really damaging DNA and the whole life force of the animal.
If all you ate was packaged dinners, cornflakes, you know, hamburger helper, you would survive. But how healthy do you really think you would be?
The real truth is that really, literally, there are no controls. All the manufacturers are obligated to do is to list the ingredients on the food and also to list what's called the guaranteed analysis. And that guaranteed analysis tells you the amount of protein, amount of moisture, the amount of fat, and the amount of fiber in the food. And if you meet that, then you have made it. You have made it as a pet food. And I'm sure Dr. Roman and I go back a long time, and we all remember Mark Morris from the Hills Company, and what he actually did was he took an old pair of shoes, he took 3 or 4 pieces of coal, and he took a quart of crankcase oil and mixed it all together, ground it up, cooked it, sent it into the laboratory to be tested, and it met the minimum requirement for a pet food.
How's about cooking something up with me?
This is so funny. There's a bag of dry food at the supermarket, and there it is, this big yellow bag. And it's got a great big red starburst on it. You know how they do. And it says, meat. And underneath it, a little disclaimer that says flavored, but nobody bothers to read the flavored. Right. They think it's all meat. So these animals are getting this heat processed food, where the molecules of the food have been distorted because of the heat processing. The food comes into the animal system. The body doesn't recognize the altered molecule. So what does it do? Up goes the defense mechanism, and out come the antibodies, and before you know it, you've got an allergic response. And that's going on constantly.
So, you know, each generation gets weaker and weaker, and the autoimmune problems get stronger and stronger and stronger, and the cancer rate goes up and up and up. And, you know, when you have 46% of dogs getting cancer, I don't remember, do you remember that? I mean, I've been practicing I've been in the veterinary field since I was 10, doing cages. I can never remember the amount of cancer cases that
half the dogs in the United States, as you pointed out, half the dogs that die from cancer. Right. Half the people that call me up about, you know, to have their animals taken care of have got cancer. And lymphoma, malignant lymphoma is, my gosh, it's like an epidemic.
It is frightening. As you know, just recently, cancer became the most common cause of death in people. The children born in the year 2000, cancer will be the most common cause of death in those children. But cancer is the #1 cause of death in dogs and cats, and sadly the incidence is going up.
But isn't it interesting, in 1985, what happened to the cat? We had 2 new vaccines, a killed rabies and it killed feline leukemia, both of which were adjuvanted, both of which contained the most provocative adjuvant, aluminum hydroxide. And that's when this incredible increase in fibrosarcomas was documented. Now, what have we said? We've said, well, the best recommendations that our profession has come up with is rabies right, leukemia left. As low on the leg as possible. Why? Why is low on the leg? So you can cut their legs off. Is this the solution to the problem? I argue that it isn't. This is ridiculous. If you took your child to the doctor and said, well, we're going to put this vaccine in his little toe, because if he gets cancer, we can just cut your kid's toe off.
It was very frustrating to see cases that I couldn't really treat very well, that didn't respond well to Western medication, and to only be able to offer options that had potential harm to the patients.
The approach was based on pathology. So you learn how to recognize what unhealthy animals look like, but you're never really taught how to look at health. So that's what I had to learn. I had to realize what was I trying to do? And so then I started looking at what is healing. I had to learn that, like inflammation. Inflammation is the first step in healing. So what do? We come up with anti-inflammatories. So we work on how to get rid of the symptom. That's reductionism, that's what we're taught. So I had to rethink that, really, which wasn't very hard for me because I was already brought up that a fever's good, fasting's good, diarrhea's good, vomiting's good.
In 2004, at the age of 55, I started studying acupuncture, and it completely revitalized my career. I went on to study Chinese herbs, then I got interested in homotoxicology, and it's a never-ending process. Once you start studying alternative therapy, you never stop.
I think, coming into the alternative modalities, you start to really question what really health is about. Trained as a conventional veterinarian, like we all are, we have to go through it all the same way. I think we never were really taught what good health was.
Veterinary medicine, the way it's taught, the way it's practiced, the way it's become commercialized and corporatized, lacks a soul. It's divorced itself from the real content that I think so many of us go into veterinary medicine for, which is to have that connection, that heart connection with the animal. And the aspect of alternative medicine that speaks to prevention is, I think, really important. If you can nip the problem in the bud before it occurs, if you can educate the public, then that's the best remedy of all for chronic disease.
I feel like I understand medicine much better now than I did before. Conventional medicine is a lot about treating symptoms, and alternative therapy is more about enabling the body to heal itself. So I've gone from feeling like a doctor to feeling more like a healer.
My goal, like the old Chinese practitioners, is to make an animal healthy. I don't get hired to manage crises. I get hired to maybe manage the crisis, come out on the other side, develop a plan so that animal doesn't have a crisis again. So if I'm doing my job right, my clients get to the point where they don't need to see me very often.
Once you do go beyond conventional Western medicine, yeah, there's continuous advanced training in all these different therapies, and it's a labor of love. It's a labor of passion. Like, if you know that you can help an animal that can't be helped with conventional medicine, and you know that there's a way, how can you not go there? How can you not offer that as another option to help that animal heal? So then you just keep on looking. Now that really takes you beyond. That takes you into the human-animal bond. That takes you into a question of duality, non-duality, self, other. It brings in the bigger picture of environmental medicine. So I guess that's where my passion these days is going, is that quest for what is ultimate healing.
I find that Chinese medicine tends to go a lot deeper and tends to treat the being, the essence of the animal, and not just that one area that may be hurting at the time.
So the power of your hands and the developing that power, taking that special touch and learning how to channel the energy within yourself and then the energy from out there, the universal energy, through your hands into your animal is very powerful. And it's something that takes time to develop. You have to be patient with it, but it should not be overlooked.
I have a lot more respect for the energetics, the spiritual aspect, the intent, some of the intangibles.
It's exciting, it's never boring, it's difficult. Holistic medicine is difficult, it's never fast, it takes a lot of time to figure out the treatment. It's never routine treatment since it is tailored to the patient, but that's what makes it interesting.
But I had to go against my training.
I really believed what Hippocrates said was leave your crucibles on the shelf. And I always believed that less was best, and so that's the way I transitioned. I charged more for my office exam, and I didn't make them buy vaccinations.
Plus I told them I wouldn't see them. So it was, do you want to go keep seeing me or not? And I didn't know what was going to happen. I thought maybe I was going to be out of business. And I lost a few people, but not very many. I mean, I got more. More people started coming because they wanted to meet this veterinarian who thought pesticides were dangerous.
You cannot use so many drugs, so many side effects, but Chinese medicine play big rules.
When we prep an animal for surgery, we use acupuncture needles as part of our pre-anesthetic protocol, and we have found that we need less anesthetic medicine. I've also found that the recovery is much smoother, so we've begun to integrate pre and post acupuncture into orthopedic procedures, and we need to be hand in hand showing how acupuncture works, how herbs work, how massage works.
To integrate all of this in practice, to be able to do our workups, our diagnostics, use our ultrasound machine, our digital x-ray machine, is ultimately, if our goal is to do what's best for the patient, then we have to be open to trying anything that might help the patient. And I think we, the traditionally trained Western doctor, has to understand that some of the alternative modalities may not be wrong. The essence has to be what's going to work best for the patient under these circumstances. And I think it's a two-way street. There are some holistic doctors that I have spoken to that have incorporated it so much in their practice that they've forgotten the benefits of also Western medicine. I mean, we didn't get here and have the healthcare that we have because it doesn't work. It also works.
I just saw so many animals benefiting from an integrative complementary approach that I felt it was my responsibility and duty to spread it to the veterinary profession, to the academic institutions, because that's the way I saw it, was everyone working together, no one being adversarial. More and more veterinary schools are starting to offer and explain the scientific basis, the anatomy, the physiology of complementary therapies. So more and more veterinary students are graduating, being quite open to these therapies and accepting that that's just part of veterinary medicine.
We're still a small association, although we're growing. There are about 71,000 veterinarians in the United States. Our association has approximately 900 members. The general interest is continuing to grow. And when we founded the association, we wrestled with the terms complementary and alternative and elected to use the word holistic. That was 1982. But as times change, we have to look at that. And in fact, the board has wrestled within the last year or two about possibly a renaming of our association because we're not sure holistic's a good term anymore. It would appear at this point in time that integrative may be the most appropriate term because many people assume that if you're a holistic practitioner, you will only do alternative medicine. I want to see us as an association a larger and larger impact within the greater veterinary community, not a segmented part of our profession. We can develop veterinary hospitals where people can be comfortable that they're going to get the kind of care their animal needs, whether it's complementary or alternative.
The proper way for a veterinarian to practice right now is called integratively, where he knows both sides. He knows conventional allopathic medicine, and he or she knows alternatives, and then for each patient selects the best of both worlds or integrates both for the best benefit for his patient or her patient. We have a huge aim and focus on the alternatives because there's less biological side effects from using alternatives, but integrative or real conventional medicine is needed, surgery is needed. usually to buy time and to tamp down life-threatening symptoms as you have more time to work with alternatives to promote metabolic and immunological health.
But you can integrate differently. You can go after it two different ways. You can either use holistic medicine within a conventional context, and that works fine, and you're going to get some good results. But that's the person, the veterinarian, who maybe doesn't have the confidence, and when things really start going south in a case, they panic and they go back to the steroids, and they go back to the anti-inflammatories, and they go back to the antibiotics. Or you do conventional medicine within a holistic context, and that's what I try to do. That every time I come up and see an animal, the first thing I'm looking at is I'm trying to look at the whole holistic approach. Is this a chiropractic case? Is homeopathy probably needed here? Is this more of an herbal case? And then if I examine the horse, then I go, all right, this sounds like something that needs a little bit more of something conventional. We need to get some good diagnostics. Maybe we need to go get a bone scan. Maybe we need x-rays. Maybe we need some blood work. So that's how I approach it, and that's very different because right off the bat, I'm taking more of a holistic approach where I say, I'm going to pull in the parts of conventional medicine that are not going to be suppressive to an animal's immune system, but could give me more information that makes it easier for me to come up with the appropriate treatment plan.
So best medicine, I think, is integrated medicines where everybody work together the best for the animals.
Everything that we do homeopathically has to rely on an animal that has a good nutritional
Absolutely.
base, and because the vital energy will not work if the nutrition is not being supported.
It seemed that whenever I started feeding my dogs some raw food in their diet, their coat became more shiny. They seemed to be more vibrant as far as their color. They just seemed to be a lot more red, and they didn't smell anymore. I don't have to bathe them, which is the most exciting thing about it.
I was changing the diet for a month and then asking the client to come months later, see what was left, and then treated the animal at that time. And you will not believe the change that can happen just by nutrition. It's flabbergasting.
So I'm saying this historically, if you go back and read how medicine over the centuries, how it has evolved, historically this has happened before. It comes to a point where the system isn't working very well, and then other systems spring up, and it changes, and now we do something else. And I think that's probably coming.
It's amazing to me what life with a capital L does when you turn it loose. And a lot of alternative medicine does that, you know, instead of depending on a drug to do it for you, you open up an energy channel, or you open up a cell's ability to heal, and then the cell all of a sudden goes to work for you instead of just sitting there like a spectator, and that's pretty cool.
My dream is that before I die, the alternative medicine will not be 11-hour medicine. So I believe that since economics pretty much in our culture drives everything, that it'll come from the general public rather than from the profession itself.
I feel that I have a global mission, that what I want to do is to, as long as people will listen to me, I want to empower people with what I hope is some thoughts about integrative or a comprehensive care, not only of animals but also of people, how veterinarians can be an important part of the global healthcare community, that what we do in veterinary medicine can benefit people and of course all of animals.
There's a bigger picture here of the health and well-being of humanity and of society, and a lot of people who are in this work feel that the use of allopathic drugs and so forth, well-intentioned and scientifically based as all that is, that the effect of a lot of that, because it ignores more the vitalist aspect of human beings, that it has caused a suppression of healthy dynamics that is playing out in society. And I feel a little bit at times like tilting the windmill. It's like there's such a huge behemoth of energy going in the direction of a lot of things, but of allopathic medicine and of fragmentation in general in our society, of different disagreements of religious beliefs and political beliefs. And at the same time, there is an undercurrent of wholeness and of hope that's coming from people, of which I feel that this is just one small current, that it's something that's bigger than all of us. And you asked me what my hope was, and my hope is really that unfolds and that the world becomes a much more harmonious place.
Good boy.
Okay, this is Roxy. I know she kind of looks like her sister, but this one is Roxy. Whoa, Roxy Raider. Rosa. Where Rosa? It's a moose. And he doesn't listen unless he wants to.
Yeah, we had a picture, yeah. Come on, okay guys, let's put the hat on. Sit, everybody sit, stay. Through. Good girl. Let's do that again. Over here. Geneva, sit.
And they love her. She's really sweet. But she's probably, of the puppies, is probably, you know, I think it's going to be the one. You know, I thought she was going to be really big. But if she, I don't think she is. I haven't seen her actually next to these other ones now. But,
So you're in contact
but instead it pops, it's because of the relaxation of the drug. She slightly comes out a little bit, so they wouldn't pass it. So I was, without anesthesia and then with anesthesia. But we sent the one with anesthesia in and they rejected it. So now I have a call into them because I really want
Okay, good girl.
Acupuncture is alternative medicine? But my goodness, acupuncture's been around for thousands of years. If anything, conventional medicine should be alternative medicine.
Very true.
What?
I mean, you know,
Do whatever you can to break away from the necessity or the convenience of buying cheap food in can, in bag, because you absolutely have no idea what your animal is eating, and when they die or they get sick, it's oftentimes too late.
Stella.